As we have now alluded to posterior anatomy on two separate occasions, let us now take a brief look at the posterior knee in order to enhance our understanding of this anatomy. For orientation purposes, we are now looking at the posterior aspect of a left knee, with the top of the screen being the proximal thigh, the bottom of the screen being the distal leg. To the left is the lateral knee, and on the right is the medial knee. As you can see, the popliteal fossa is bound laterally by the biceps femoris and the lateral gastroc. Here one can appreciate the common perineal nerve as it branches off the sciatic nerve, passing behind the biceps on its course around the proximal fibula. The plantaris tendon is also visualized in this specimen. Note the popliteal tendon as it exits the knee joint and inserts with its muscle belly on the proximal posterior tibia. Medially, the popliteal fossa is bound by the medial gastroc, semimembranosus, and gracilis semitendinosus. Again, the insertion of the semimembranosus on the posterior medial tibia is appreciated with its accessory insertion on the posterior capsule, the oblique popliteal ligament. Appreciate the intimate relationship between the neurovascular structures and the posterior capsule. In fact, after exiting Hunter's Canal, the popliteal artery travels distally to lie directly on the oblique popliteal ligament, medial to the tibial nerve. It should now be apparent why there is a real concern for neurovascular injury in patients with high-energy knee dislocations. For completeness' sake, we also show here the superior and inferior medial and lateral geniculate arteries. Although they do serve as a tether for the popliteal artery, these vessels can be an important source of collateral flow should a vascular injury occur between them and the more distal bifurcation. In this artist's rendition of the posterior aspect of a right knee, the deepest aspects of the knee are shown. With the oblique popliteal ligament and posterior capsule reflected, we see the popliteal muscle and the posterior cruciate ligament as they insert on the posterior tibia. Also shown here are the meniscofemoral ligaments of Risberg and Humphrey, which lie just posterior and anterior to the posterior cruciate ligament. These accessory ligaments are variably present in the human knee and function as stabilizers of the posterior horn of the lateral meniscus.